Practice sim, receiving feedback from Clinical Instructor.
Thank you for meeting with me today.
Yes, thank you for having me come in today.
Well, we have a few things to discuss. Um, the elephant in the room seems to be that you don't seem to have a good understanding of the basis of physical therapy. Last week, I told you that you haven't been able to apply the knowledge and skills to the safe and effective identification and management of patient problems. Do you remember that?
I do, yes.
Okay. Do you remember when I asked you if the cane was adjusted properly and you said yes?
Hmm.
Okay. And I asked you how you knew and you couldn't explain the reasoning?
Yes.
Okay. Do you have a reasoning now for how the cane was adjusted properly?
Uh, I don't, no.
Okay. We need to fix that problem. Okay.
Okay,
All right. And I expect an answer within a week. Okay.
yes.
My other problem is that we haven't been seeing proper techniques in demonstration. For example, you quickly removed a knee immobilizer from a patient with a fracture without following the proper steps. Do you remember that?
I do, yes.
Okay. Do you have an explanation for that?
I thought I was following the proper procedure at the time, and I did not realize the mistake that I was making.
Okay. Do you realize how dangerous that whole action was for that patient?
I do, yes.
Okay. Yeah, because that could have caused a fracture. Okay.
Hmm.
And yeah, that knee is quite delicate. So we don't want to risk any re-injury with our patients
Of
while we're
course.
doing physical therapy. Yeah, so we have to be very careful with the way that we remove immobilizers or anything that's put in place by the physician. Okay.
Hmm.
All right. Um, now another thing is I feel like you don't give enough guidance during patient treatment sessions. And while I'm listening, I often even find myself unsure of what to do within those sessions myself as if I was the patient. Um, so what is going on within those sessions?
Um, I'm not sure. I was under the impression that I was explaining things well enough. Do you have any suggestions for what I might do to communicate better with my clients?
Well, I feel like you need to go over those exercises prior to those sessions um, by yourself. Make sure you know what you're doing um, on your own so that you can demonstrate to the patient. Make sure that you can help guide the patient through those exercises so that they don't feel like they're lost, um, so that they can perform those exercises safely. If they're doing them incorrectly, you can help correct those movements and guide them through a safe and effective series of exercises that help strengthen the the necessary um, movements rather than just feeling like we're kind of out in space, which is where I kind of feel like we are right now.
Right. Okay.
Okay.
Were there any um, specific moments where you maybe felt that I wasn't doing a good enough job of helping the client understand what they're supposed to do, that I should maybe um, go back and reflect on?
Well, right now, I think it's in general, and I don't think that you're on track for a satisfactory grade. So I think that you need to go back and revamp everything that's going on. If you need to use a gate belt, use a gate belt and ask permission to get in close and use that gate belt the way that it's supposed to be done. If you need to use the cane, make sure that it's adjusted properly. Make sure you know what you're doing with your exercises. Make sure you know what you're doing with braces and immobilizers. Just go over everything. Read your material, practice with other students. Ask them if you can practice your exercises on them. Just make sure that you know what you're doing.
Right.
Okay.
Hmm.
All right. Well, thank you for coming in, and let's check back in a week.
All right. Thank you.
You're welcome.
End simulation.